Hi, my name is Wileen. I'm a registered nurse and I'm the director of Foundations of Health Medical Academy. So today our practice skill is going to be emptying of a catheter. And what a catheter is a tube that is inserted into the bladder. What is the bladder? The bladder is a ball that contains, it's like a sac, and that is where your urine is collected, or what some people know as pee. And so if the signal to the brain does not work, say that person had a stroke, they had a brain injury, they have Parkinson's, or something that affects the spine, sometimes the signal from the bladder to the brain don't send the signal for the tube that carries the pee out to open up and let the urine out. And so that's why it's very important, if a person has a catheter, it's very important that you report their output. What comes in must come out. And it's also important that you document the color, the amount, and whether it's clear or not. All of those things tell your nurse what's going on with your patient. Remember, CNAs are the eyes and the ears of nursing. Everything you say, everything you do and report are important information on taking care of your resident. Every hour, the body makes about 30 mLs or cc's of urine. So for your 8-hour shift, that person should make at least 240 cc's of urine. If that patient hasn't had any urine in their bag, or it's less than, that is an important piece of information to notify your nurse. If the person has more than 240 cc's, it's still important that you report to the nurse, but at least we know that that catheter is in the correct place and it's functioning properly. So what you report is very important. So every 8 hours, your patient should make a minimum of 240 cc's or mLs of urine. Most urine is yellow and clear. Anything that is not yellow or clear is considered abnormal. So anything that is abnormal, you want to report to your nurse. These are very important pieces of information that you need to know about your patient and reporting to your nurse. We're going to start the skill. May I come in? Hi, Mrs. Smith. My name is Wileen, and I'm your CNA for today, and I'm going to empty your catheter. Is that okay? Yes? May I check your vein, please? Okay, Mrs. Smith, I am going to close your curtain for privacy, wash my hands, gather my supplies, and I'll be back. I'm washing my hands, I've gathered my supplies, and I'm back. I'm back. Okay, Mrs. Smith, I'm going to start your skill. The first thing you want to do, anytime you're going to be coming into contact with any bodily fluids, which are blood, sputum, or spit, and also feces or stool, you want to always put gloves on to decrease the risk of infection. So the first thing we're going to do is put our barrier down on the floor. This is going to protect any bacteria from being transferred from one area to the next. So if urine falls from the catheter, it's going to fall directly onto your border. Next, you're going to grab your graduated cylinder, which will have measurements on the side of it, and all of it will tell you how many cc's or mLs the patient has voided. Anything in between, so say this area says 500, that area would be 525 and 550. Again, that's going to be an estimate. So you're going to use this to collect the urine. You're going to have 2 alcohol wipes. I'm going to go ahead and open those up and lay them directly on top of my paper for easy access once I open the catheter tube. Put those 2 down on the ground. This is called a dignity cover, and this is used to protect the patient's dignity because no one wants people to see their bodily fluids. So this is a manner of protecting the patient's privacy. You may also see a regular catheter bag with no dignity cover. In that case, you want to find a dignity bag, which most facilities have, to place your catheter bag in. In this case, we are going to just lift it up to reveal how much urine is in the bag. On the bag, you'll see an amount of estimated urine. This is just an eyeball, so when you're walking by the room, you can look at this catheter bag and see Mr. Smith has about 1,200 cc's in his bag. So I'm not going to go and document this measurement. This is just something for me to be able to walk by as I give care and know that my patient is urinating enough for the day. And I don't have to stop and report to the nurse right at that moment. He's okay. So what I'm going to do next is place this canister directly below the spout. This spout is always kept here for infection control because it's been cleaned, and this is a way to keep it free from collecting bacteria. So I'm going to take this out of the pouch. I always point my tube down towards the canister. You never want to open your tube this way because this urine will come directly to you, and we don't want that. So you put it down, you're going to push this blue tab, and you're going to empty out your bag. We're going to say that we're done. And now I'm going to push this back. And you may find different types of catheter bags and different spouts. You want to become familiar with the type that your facility uses. Now, before I put this back here, because urine harbors infection, so that means that this tip can get a lot of germs easily, I want to always clean the outside with one alcohol wipe. I will fold one alcohol and kind of wipe the inside out. So I'm going to wipe this outside out with one, put that down, fold one up, and kind of clean the inside. Doesn't have to go all the way in, but just to kind of clean it off a little bit. Now that that's clean and this is closed, I don't want to leave this open so urine doesn't go all over the floor. I'm going to put it back in its protective pouch and always maintain patient dignity. Cover this back up. And I'm going to pick up my canister like so. Just fold everything over, and now it's in one complete clean package. And so I'm at the bathroom now with my container. I'm going to either put this on the cabinet or on the toilet, which is a flat surface, to measure. So I grabbed a napkin to put that down, and I'm going to leave this on the barrier. Open this up, and I can throw these alcohol wipes away. And I'm going to squat at an eye level to measure how much urine is in here. And the line is between the 600 and the 650, so I'm going to say it's about 625. 625 mLs or 625 cc's. Now, I'm not just gonna grab this cup or canister with my hand. I'm going to grab a napkin to hold it like so. I'm gonna take my barrier, throw this in the garbage, open my toilet back up, throw that in the garbage. I'm going to turn my water on with the napkin, throw that in the garbage, and this urine I'm going to pour into my toilet. Now I'm going to take some water and rinse. Try not to touch any parts of the sink with your canister. And I'm not going to splash. I'm going to pour that out. One. I'm going to rinse 3 times. 2. 3. I'm going to take a napkin and flush. Take a napkin and turn my water off. Throw that away. Take one napkin and wipe the outside of this canister off. Throw that away. Take another napkin and wipe the insides. And what I'm doing is I never wipe either side of the canister with the same napkin, and I don't touch multiple things with the same napkins. Now I'm going to grab this with a clean napkin, and I'm going to grab a napkin to open my drawer, because my hands still may have come into contact with urine, and so I don't want to touch the drawers with my natural hands. So I'm going to use this to open the drawers, place my supplies in. I'm back. Again, I'm going to use this napkin to open the drawer, and I'm going to place this down with the napkin still in hand. I'm going to drop that off. Now I have both napkins in my hand. I'm going to throw this away in my bag, take my gloves off, and wash my hands. Okay, my hands are washed. May I come in? Okay, Mrs. Smith, you had about 625 cc's of urine. It was yellow and clear. Okay, do you need anything else? No? Okay, well here's your call light. If you need anything, call me. I'm gonna put your bed down. I'm gonna open your privacy curtain, take my supplies, wash my hands, document, and my skill is complete. At this time, I will go and wash my hands, document the color, the amount, and whether it's clear for urine. Remember, CNA's everything you see and do is vital to nursing. Thank you. Until next time.